Hi everyone, welcome back to Real Talk, our campus weekly video series where we discuss relationships, empathy, advocacy, and life. All of our episodes are pre-recorded and released every Tuesday at 5 p.m. on Instagram and Facebook through YouTube link. And today, as you may have noticed, we have an amazing guest speaker. I am super excited to introduce her. Jasmine and I actually used to work together when I was living down in Florida. And now she's doing obviously more even amazing things, helping the community. And our topic today is around sexual health. So we're going to talk about STIs/STDs, talking about how to disclose your health status to a partner, kind of debunking some myths around STDs and things like that, and talking about safe sex and all those kind of range of topics. So we got a lot that we're really excited to get into. So Jasmine, I'll let you kind of introduce yourself and give us an idea of your background.
Yeah, thank you so much, Cara. Yeah, I miss working with you, but I know you're doing good things over there. Like Cara said, my name is Jasmine. I am a health educator here in Florida. I work in sexual health education, and primarily I work with middle and high school students, but I also work with their parents and some adult groups as well as college students. So super excited to be here. This is my favorite kind of stuff. So this is fun.
I know, it's so funny. Like the benefit of having virtual stuff is that we get to connect and do stuff like this. So thank you so much for being here. We're really excited. And obviously this is something like at one point we were all in college. I won't give away when, not that it matters. But it is something that going into this episode, is thinking about of how important this topic is and how many questions I remember myself and my peers having during college time about sexual health. But it was still, and maybe even today, and you'll have obviously more kind of inside knowledge about that, of how taboo it still is to talk about these different things. So I thought, as an icebreaker to kind of get us in to the conversation, to start with some myths and/or facts, and you'll tell us if it's a myth or fact, and then maybe share a little bit of information about it. So I'm going to pull up my handy dandy list here. All right. So number one, myth or fact, or true or false, whatever you want to say. You can see, do you want to start actually with the difference between STD and STI?
Oh, yes. Yeah, so really quick. Yeah, so STD and STI are truly just interchangeable. So what happened is we just changed the language. So scientists and the medical community, we thought disease sounded a little too intimidating, right? So all STIs can be treated. They all can't be cured. So that's the difference. So disease sounded like, doom, life is ending, and that's not true for any of them, right? So we can either cure you, and then we can most certainly treat you so that you can continue to live a healthy life, including your sexual life. So we just changed the language, but same thing.
Awesome. Cool. Thank you. Okay. Sorry, I forgot, because that's going to be helpful, because all of these myths and/or facts include the language or the verbiage of STD. So good to know the difference. Thank you. All right. Number one, you're ready. Is you can see an STD if your partner has one.
Yeah, that is so not true. Unfortunately, a lot of people think that, and for good reason. So if you think back to like your middle school sex ed class, if you had one, right? A lot of people say, oh my gosh, my teacher showed me all these scary photos. It was awful. Right? And so a lot of folks think that, okay, well, if my partner or I, if I don't look like that, I'm good. And the truth of the matter is, most of the time, those pictures are incredibly old. They're so old. And also, they're usually someone who's at a later stage of their disease progression. So, having syphilis for 3 months is definitely not going to look like the photos they've showed you. Wow. And what's important too is also that many people are asymptomatic. So meaning they don't show any signs or symptoms, especially within the first 3 months of being infected. So, visually diagnosing folks is not a good idea because you truly don't know. They may not even know, right? So you never necessarily take that chance there.
Yeah. I feel like I'm going to learn so much from you today. Not feel
No.
like, I know I'm already learning so much. Well, and that's why
I know, and I've already.
Go ahead, Cindy, sorry.
Go. I was just gonna say, I've already heard you say so many things that I'm like, oh yeah, I had a conversation like that with a client, or oh yeah, I talked about this with someone. And like when you were saying like you might not even know for the first couple of months, we always talk about with our clients who we go to the like hospital with when they have to get the forensic evidence collection kit done after a sexual assault, like they test you there, but like it's only showing you kind of what maybe you already were coming in with. We recommend you get tested again 6 months later, and like we can help you figure that out and you know what your resources are. But it was like, it's just going to be so relevant. I'm so excited for the rest of the conversation.
I know, me too. That's actually another question that maybe we'll kind of bank for later, but just thinking about how many times it feels appropriate or safe for particularly college students, that's our population, our audience who watches these videos, to get tested, you know, to test themselves. So maybe we can pin that one for later. All right, you ready for number 2?
Do it.
All right, number 2, you can't get an STD if you only have oral sex.
Okay, very, very common misconception. So first, let's start off with basic definition of sex, right? A lot of folks think, oh, that's, you know, normal sex, which is wrong terminology, right?
Right.
So we're going to go into what sex is, and there are 3 different kinds, right? So you have vaginal sex, oral sex, and anal sex, right? You know what, just for funsies, let's do definitions, right? So vaginal sex is a penis in another person's vagina, right? Oral sex is someone's mouth on another person's genitals. And then you have anal sex, which is a penis in someone else's anus, rectum, or behind, right? So you have all the different types of sex. Now, people sometimes don't consider oral sex to be sex because of the no risk of pregnancy. But that's false. One, because you certainly can get STDs, and I'll go into that a little bit more in a second. You know, but different types of people, you know, have oral sex, right? So we want to be inclusive of everyone, regardless of your gender identity or expression or your sexuality. And so some folks do, you know, prefer oral sex over, you know, different types. Now, as far as oral sex goes, right? So it's about the fluids. That's what STIs are found in. So we're talking, you know, anal fluids, semen, which is a mixture of fluids, including sperm, right? Sperm is the cells, semen is the fluid, and then also vaginal fluids. So when you perform oral sex, your mouth is coming in contact with those fluids. So if you perform oral sex on someone who has an STI, there's a really good chance that those fluids can get into your mouth and infect you that way. Typically, oral sex, when you perform it, you know, if someone's infected that way, it'll present itself in the throat. It's not going to necessarily present itself on the genital area unless it's herpes. That's a little different. But usually we, you know, all the typical symptoms that you might get, you know, from vaginal or anal sex are now in your throat. So think like sore throat, swelling. You might have some of like that greenish, yellowish discharge, but now in your throat. So definitely possible. But as far as bacterial infections that come from oral sex, all curable. We just have to get tested and get the medication.
Cool.
Can you quickly go, when you were just saying, except for herpes, because that's a little different, can you kind of break that down a little bit?
Yeah. So herpes is a virus, right? So I've been trying to break this down with my kids too. Like think about coronavirus, right? So many different people are infected, but some folks have no symptoms. Some folks are mild, some have very severe. And that's due to the fact that it's a virus, right? Everyone's body is going to respond very differently to having a virus in their body. So herpes is very similar. So if I have the herpes virus in my body, right? When I have an outbreak, meaning when I have bumps or sores on my body, my outbreak is going to look different than another person's. I could have really severe, I could have very mild. I may not even get an outbreak. I might have an outbreak once a year and I'm like, where did that come from? And then it goes away. So I may not even know I have herpes, right? And that goes to the same how it presents itself. Sometimes, especially if we're performing oral sex and that's how we were infected with herpes, sometimes it might present itself like a ring around the mouth. So it's definitely different than like a cold sore. Or it could also present itself on the genital area. So it really just depends on how your body responds. So you just need to have that honest conversation with yourself, right? Is it potential that I was put at risk for this? And so we need to go get tested and see exactly what it is.
Right.
And now, sorry, I have another question.
No, go for it. I was just going to see which ones I want to do next. Go ahead.
While we're here, while we're in this part of the conversation, I know from like research, right, there's 2 different types of the herpes virus. Does that, like, when you're talking about performing oral sex, but it's showing up on the genitals, like, is that a correlation? Is it different, or is that just how the virus will show up in somebody's body?
Right. So it really just depends. So if you think about the different types, right? Herpes simplex 1 is going to be the one that typically is the sexually transmitted one that will show on the genital area. Herpes simplex 2 is more so like that cold sore virus that folks have. So that's going to be the things that you see in people's mouths and maybe on the gums and things like that. Mm-hmm.
Thank you.
You have such a wealth of knowledge. I'm like so happy you're here.
Happy to be
and I missed you. I missed working with you too. Okay, so the next one, I actually have a combination, like this is one I found on the internet, but I also have an additional like add-on to this one. So the next one is you can get an STI from a public toilet. I'm gonna add or from trying on underwear or like a bathing suit in a department store or something like that, because that's another one that I've heard as well.
I have not been asked that. That's interesting.
Really? Oh, okay.
Yeah, I have not heard that. So toilet seats, all those rumors, no, right? Absolutely not. So people say, well, why do they have those little paper things in the bathroom then? I'm like, bacteria. Right? Not STIs. That would be like the biggest public health nightmare. Like we couldn't have public.
That's so true. I didn't even think about that.
Like what would we do? But I will say that rumor kind of started like back in, you think like when the AIDS epidemic was, huge, like late 80s, early 90s, people were terrified, right? Mm. So, in the mind of, any civilian, yeah, of course, like there was bodily fluids in the toilet. Of course, that's one way it's transmitted. So it kind of makes sense, until you learn the education, right? Especially like HIV. HIV is only found in semen, blood, vaginal fluids, and breast milk, right? That's not on the toilet seat.
Hopefully
and
not.
even if it is, right, HIV dies super quickly once it's outside of its host. It doesn't like the air. It's going to die pretty quickly. Also, just a general rule of thumb, guys, if you see bodily fluids anywhere, do not touch it. Do not touch it, right? PPE, right? Personal protective equipment, gloves, right? So if you're in Target, go get the person who has that. That is not you, right? And I'm not really concerned about STIs, especially when it comes to blood. I'm more concerned like hepatitis and like bloodborne stuff, right? That can survive on the surface for hours. So that's really what I'm more concerned about. But yeah, total myths as well as bathing suits and things like that. Also, when it comes to like trying on underwear, I don't know. Personally, I would say let's guesstimate, or buying those types of things. I know bathing suits are so hard because they, the small is this big and then another small is this big. Like I fully get it. But I know they also have that lining in there to, kind of separate, and they always keep your undergarments on as well when trying on undergarments. And if possible, especially like bathing suits, like especially during summer season or here in Florida, 12 months of the year, you could even wash it if that makes you feel more comfortable, and not so much of disease infection, but I always think like sweat, like how many people have tried this on. But as far as, being infected, we're good.
Cool. That's good. It's good to know. It's something that I definitely heard a lot about, the like trying on underwear and stuff.
Yeah,
like
I have not heard that. That's so interesting. Yeah.
Okay, and then the last one, and I think this will actually be a good kind of maybe segue into the next part of our conversation, is an STI resolves on its own. You kind of alluded to this earlier, I think, but let's see. Is that a myth or a fact?
Sure, that is a myth. I wish it wasn't, but the fact of the matter is that we need medication, right? So, you know, all of our viral STDs, so when you think viral, think herpes, HIV, hepatitis B, as well as HPV, which is the human papillomavirus, right? Those are all of our viruses. So I can't cure you, but I can give you medication to treat the symptoms that the virus causes, right? And unfortunately with STI viruses, not only can you spread them, but if you're not on treatment, it can cause you to get really sick, right? So herpes, you know, not necessarily like falling ill and things like that, but it can be really uncomfortable, right? You know, there are bumps and sores on the genital area. They might ooze. I always think of like them being like in the groin area, just really uncomfortable, right? You know, HIV, of course, directly attacks your immune system, which can make you really, really sick. It compromises your immune system. So even though, you know, we're in 2021 and we've got all these great vaccines and things like that, unfortunately, people still die due to complications of HIV and AIDS. And really quickly, AIDS is not a separate STD. It's a stage of HIV. So it's kind of like a final stage. So what happens when your white blood cell count is 200 or less, and you can no longer fight off disease. So at that point, you're very sick. So we definitely want those folks on medication, as well as for all the other viruses. When you're thinking bacterial infections, so think gonorrhea, syphilis, chlamydia, our parasites, trichomoniasis, pubic lice, or crabs is the nickname for that one, right? All curable, right? But we still need to go see the doctor to get the medication. For crabs especially, I have a lot of folks that are like, but I shaved. And I'm like, no, right? You know, just like head lice. Like, what did you do in kindergarten when you got lice?
Yeah.
I got a special shampoo. Same thing. You need a special medication, right? Not just a great shave job. You know, I don't care what design you do. They're still there, right? So just being really conscious about that. Over time, so I'm talking months, maybe years, and some folks who for some reason never get tested and for some reason don't get medication. That could be, you know, fear of going to the doctor, lack of access, lack of, you know, lots of different things that might hinder folks from going to the doctor to get it treated. Eventually, some of the typical STI symptoms will fade. So things like, you know, pain or a burning sensation when you pee, that discharge might be gone, things like that. But what happens, especially if you think like syphilis, for example, it likes to live in other areas of the body. So now it's progressed into different stages. So with syphilis, typically it'll start your regular STI symptoms. Then it's nicknamed the pox. I don't know if anyone really says that anymore. But the reason being is you get these little red dots on the bottom of your feet and on the palms of your hands. They don't hurt, they don't itch, they're not contagious, they're just kind of there. After so many years, syphilis likes to affect your eyesight. It starts to eat away at all those nerve endings behind your eye.
Wow.
So yeah, so some folks will, you know, could really, you know, their eyesight is really affected, or they can go blind. And then final stage syphilis is going to be fatal in the way that it eats away at the brain. And so we do not want that, right? And then in between, syphilis can also cause sores on the body, open sores that are not painful, they're just there, right? And we just don't want these things for folks, right?
Yeah, none of that sounds good.
Yeah, and we see it all the time, and I'm like, oh, I just want to get you to a doctor.
Right, if there's medication for it. Yeah.
Right, you know, it's an antibiotic, like it's nothing like super insane, you know?
Yeah.
Is that a lifelong antibiotic you would have to take, or?
Oh, that's a good question. No, typically, especially if you catch any of your bacterial or parasite infections fairly early, you're looking at like a 10 or 12 day pill, maybe a 2 or 3 time shot in your butt, but you know, that's it.
Okay.
This was so interesting. So the two things came to mind when you were talking about that. First was kind of going back to my question earlier of like, how often do you think or would recommend, I guess, like for college students to get themselves tested? And then the other question totally just popped out of my head. Oh, how common is it? Because I think that's another thing that when I was in college, like people didn't talk about it, and it was still, and we're going to talk about like the stigma attached to STIs and everything later on too, but because of those stigmas and still, you know, present today, people didn't talk about it, so people didn't disclose. So how, I guess two questions, you know, how common is it for college students to have it? Like how many college students have one and don't know, or have one and don't disclose or whatever? And then also how often should college students probably get themselves tested?
So I'm going to reverse your questions. I'll do the how common. So typically for college students, we're looking at 1 in 4 has an STD, right? So that's pretty high.
Yeah.
And you know, for many different reasons, right? You know, if they're sexually active and they're not using protection to have safer sex, if you're someone who has multiple partners, you know, when I talk to my students, I have really real conversations. You know, it's yes, of course, multiple partners. It's yes, of course, maybe you're not using protection, but it's also the different types of behavior that go with it, right? So, you know, drugs and alcohol use. You know, are you using substances? Are you forgetting to use a condom when you are in that encounter? Are you using that condom the right way, right? There's a right and a wrong way to put on a condom. And if it's wrong, that effectiveness percentage goes down significantly, right? Are you using other forms of contraception as well? So STIs are incredibly common in the college community. And because of that, and that's in general, you know, in college for sure, but also, you know, just in the general public, you know, by the time, you know, someone's 24, 1 in 3 will have had an STD, right? Wow. So really common. So I say that to say, I hope that people take those statistics, and if they are ever diagnosed with one, whether curable or lifelong, that they know that they're not the only one that is going through this.
Totally.
Right? So when you go get tested, you know, please know that your testing counselor, you know, we're not there to judge you at all. We really just want you to get tested. Tell us, you know, have an honest conversation with us so that we can give you the information to make the best decision for yourself. And then either get you medication, give you resources like free condoms. There's lots of different types of condoms too. We can go into that if you want. Yeah. But different types of condoms give you information on where to get free birth control or low-cost birth control, and all of those things, because they are so incredibly common, right? Now, as far as testing, I always recommend that if you're in a monogamous relationship, so meaning you and that person are only having sex with each other exclusively, I recommend testing at least once a year, at least. For women, I always like to say, or anyone who goes to a gynecologist for pelvic exams, please know that STI testing is not routine.
So glad you just brought this up. Yeah. Thank you for saying this.
Yeah, so if your gynecologist is, you know, when they do the pap smear and they swab for cervical mucus, that is not your, oh yeah, I'm good. Nope. They do not test for STIs. You can ask them to, but it's not routine. They need to add it onto your work order. You know, and if you don't go to a gynecologist or, you know, whatever, you know, always look for resources in your community of what might be free, especially on a college campus.
WCSU does them monthly, I think. I don't know with COVID, but I would assume that they are.
Yeah, also refer your students to like their local health department. Sometimes it might be a bit of a journey depending on where you're at, but typically most health departments will have some sort of STI clinic where it'll be free, and that's federal dollars, so it has to be free. Other than that, so if you're not in a monogamous relationship, so if you're someone who has multiple partners, you know, randomly, you know, and so when you come and get tested, if you're someone like that, for whatever reason, we're going to recommend at least every 3 months. And that is due to the window period. So HIV and other STDs have that window period of being asymptomatic So you may not show the symptoms, you know, for 3 months. So we like you just to kind of always check yourself once you're outside of another window period, if that makes sense.
Yeah.
Other than that, if you're someone who's high risk, so not only multiple partners, but if you're an IV drug user for any reason, or if you're a sex worker, I'm also going to recommend you test every 3 months. If you're, you know, other than that, if you're getting a new partner, you know, my wish and, you know, whatever is before, but I know I was in college. I get it. I get it. You know, just hopefully just getting tested at some point after that encounter, right? Yeah. A lot of places will also do partner testing. You know, it's not a romantic, like a sexy date.
Activity.
How cute.
Yeah, you know, it's not a sexy date, but it's a date, and you could do that. So,
Awesome.
that's
Yeah. I think that I was saying before, I know WCSU does the STD clinics. It was once a month before everything was remote and weird and different. It may still be, we could find that information out, but I think that they even contract in a different company to do that, so that students even feel like there's another layer of like confidentiality, so that like, you know, when they might have relationships with the staff, like our nursing students at WCSU might do some clinical hours in the health services like center or whatever. And I think that they bring in a separate company to do this, just to kind of really super ensure and encourage people, like, go do this. You know, the signs are up all over campus with this idea of like, how can we destigmatize in any way that we can? If it really is, you know, it's 1 in 4 people, that's really high. Like, it's a common thing. It's crazy. We still have to have those conversations of like,
I know
this has to be like accepted. Like, why are we not just, you know?
Yeah.
And just one more resource, because of the pandemic too, our testing has also looked really different. But there's an organization that they're all around the country. So I'm not sure if they're one there, but they probably have one. It's called CAN Community Health. And because of the pandemic, they've seen the same thing. Their testing numbers are so low because they can't see people, or people are nervous to go out. So they've actually been sending free home testing kits. And then it has all the instructions. You can call them if you have questions, and then you mail it back to them for free, and they'll give you your results. So that's awesome.
You know what's so funny? The health services just reached out asking a question about that, because they were just curious if that was something that we like knew about or whatever. So that's really interesting, because I didn't know that was a thing. I thought it was maybe like fake or something, but that sounds really cool.
Yeah, there are home testing kits, but they're typically like over $50. It's insane. But they've taken it on themselves to start kind of doing, you know, all this free testing, because, you know, there was a need. So It's awesome. Yeah.
Well, the other piece I was thinking about, just obviously we were gonna eventually get to the topic of like the stigma and everything, but I think it almost couples with the idea around, and we talk about disclosures or that term all the time. Mainly we're talking about it in terms of like disclosing trauma to a partner, or disclosing trauma to a friend or whatever. But even linking the two, you know, we have a lot of clients, people that we help and serve that have maybe contracted an STI from an assault, and then now have to disclose that to any future partner or whatever, if that looks like. So I guess kind of on both ends, whether it was contracted non-consensually, or just unbeknownst to that person, you know, that they contracted one, now have one. How does one go about that kind of conversation with like a future sexual partner or a dating partner, that, you know, they have an STI or had one or whatever that looks like?
Sure. So however you got the STI, whether that was consensual sex or sexual assault, please take the time for yourself and do whatever you need to do to, you know, make sure that you're okay, right? You know, some of these STIs, although all are treatable, some are curable, they can definitely still make an impact on your life, right? Whether that's daily medication for the rest of your life, dealing with side effects for a short period of time, telling a partner, You know, lots of different things. It's still an impact. So first I want to say, make sure you take care of yourself. So whether that's talking to a trusted adult or trusted friend in your life, you know, seeking out professional help, you know, always huge advocate for that. So that's the first piece. The second piece I would think is when I talk to clients about, you know, disclosing their status, I would honestly say do what works for you, right? I've had some clients say they'd rather it be face-to-face. I've had some clients, at least, you know, through some of the clinics that I've partnered with, most of them have partner services or some sort of counseling service. You could call them up and say, hey, usually they're called like peer navigators or things like that. I really need help talking with my partner about this. Can we set up a meeting? And they say 100%, let's do it. Some folks, because they want to have it on record, they'll do a text message, which seems really informal. And they're like, how am I doing this? But some choose to do it that way. Also just, you know, might add that, just that barrier in between and being in face-to-face. You know, so I would say just be really honest, you know, when it comes to talking with your partner, especially if it is a lifelong STI. In the state of Florida, every state is very different. But in the state of Florida, if you do not disclose your status to a sexual partner, that is a felony, right? So we don't want that. And it can get messy, right? Because you're like, well, I had no idea. And the state's like, well, why were you not getting tested? And it's like, but I did, you know, like all these different things. So, you know, I always tell my students, you know, when we're doing adult responsible things, we need to be adults and be responsible and be getting tested at least at the recommended minimum, right? Now, even if you have a curable STD, still telling your partner could be really difficult. Maybe, you know, if there was infidelity or if maybe you've had this STI for 6 months, a year, and you were never tested, it was brought up in this new relationship, right? That can cause strain on the relationship. But, you know, I always say just be really, really honest. Most care clinics as well have their partner services. If you give them a list of your past partners, they will contact them on your behalf. Now they're not going to call and say, hey, Carol was here. You should get tested for syphilis ASAP. They're not going to do that. They're not going to do that. There's a whole language and a script that they use where we will definitely try to get that person in. I mean, they will find you. Like, they're like, give me Instagrams, Facebooks. Like, they will find you.
How cool.
That is so interesting.
Yeah. Now, if it's, you know, a lifelong STD, things like HIV, now we have a caseworker involved, right? You know, so for things like that, you might have someone try to track you down at your house, at your job, right? Because we really need to get you on that medication so that your white blood cell count, you know, we can start regenerating whatever those HIV cells have destroyed if you are infected. You know, so I think there are different ways of going about it, but I always just say, one, make sure you're okay. And then, you know, just being really honest with your partner as best you can, you know, and if it's going to be something, everyone's like, well, what if they leave me or what if they do that? You know, they're humans, they're allowed to do that, but we also have to have that honest conversation with ourselves. You know, was that relationship even what was best for me? You know, if they're not willing to hear me out and, you know, get tested together, get medication and all that, maybe this wasn't the best scenario for me anyway. And I'm not saying that's easy. It still might suck, but we have to do what's best for us and take care of us. So.
I think sometimes, like, just in working with the clients that we've worked with at the Women's Center, that I worked with at the Women's Center, like they've been through trauma, and oftentimes people who have survived trauma or experienced trauma think differently about themselves, that they're less than, or, you know, they start to have this negative view of themselves, and a diagnosis of an STI, or, you know, getting that, like, can kind of contribute to that negative self-talk and stuff like that. And for anyone, absolutely. But I think it's just another layer on someone who's experienced trauma, and then the fear of having to disclose it to a potential partner, or, right, like, you've not engaged in any kind of sexual activity with this person yet. You want to have that conversation so the relationship can go there. What you're reminding me, what you just said of like, no matter what, you're deserving of respect, right? So that person that you're going to tell is allowed to have a response, is allowed to have a reaction, but like, you are a person who's deserving of respect. And like, having HIV or herpes or syphilis, it doesn't say anything about your character as a person.
Right.
And it's so not cool for anybody to like point that out or make you feel that way.
Yeah, and I always like to remind folks, you know, sexual assault cases aside, because that is a totally different topic. What did that person do to get an STI? They had sex. That's it. They had sex, right? They had sex. Humans have sex. They're never going to stop, right? You know, it feels too good. It's too intimate and all these other things, right? They're not going to stop having sex, right? So that's all they did. They just got an STI and you didn't, or maybe haven't yet. I don't know. Right. And so I just like to remind folks, like, you didn't like do something crazy. You had sex. Mm-hmm. That's it.
Right.
And so I hope that takes off some of, you know, that feeling that some folks have. And I always say, you know, if you're high risk, you know, like in a clinical setting, okay, what types of behaviors can we talk about that you can maybe minimize so that maybe this doesn't happen again? Because, you know, we don't want the long-term side effects that can happen from this. Not necessarily that I'm upset with you that you have one, but I just want your body to be healthy, right? I don't want you to have this in your body again and maybe for a longer period of time. But that's all you did. You had sex and you just, you know, come to terms with that, and, you know, that's it.
Yeah.
I like that you put it that way. Like, it's just so matter of fact. Like, it's just what you did. That's it.
Yeah.
You didn't jump off a building and like steal something weird.
Well, I love, and I think that's such a perfect way to like segue into our last kind of topic. What we wanted to cover quickly is the stigmas attached. Like, there's so many stereotypes and stigmas that are really harmful, and really like not only harmful for the individuals who experience that, but also for just the lack of knowledge. And that's where all of these like myths and misconceptions and all that come from. So it's just like, we, you know, this conversation today, I'm so glad we're having it, like just us. And I'm really grateful for anyone who's viewing in our audience. But what would be kind of your message, I guess, to like help to break the stigma, help to kind of make it more normalized to talk about these things, make people feel like human beings, like you are still a human. And I love what you said, Sydney, too, about like, it doesn't change your character. And so like, what are the things that you would kind of say to help break those stigmas?
Yeah. So as far as like breaking stigma, I always like to say, one, what I've already said, you know, you had sex and you were someone who had a consequence, right? Whether that was becoming infected with an STI, whether that was pregnancy, an unplanned pregnancy, and also think outside the box. You know, my students, you know, bring up things like, maybe I didn't really want to have sex with that person and I did it anyway, you know, thinking about peer pressure and all those other types of things. So, you know, I would say we need to get comfortable talking about it, right? We're humans. People are going to continue to having sex. Sex is not bad. I think that's a message that unfortunately has just been channeled down generation after generation. Sex is bad, and in different views, you know, I think we need to get rid of that. Sex is not bad. You know, there are pros and cons to everything, including sex, but it doesn't mean that it's bad. You know, so I think to help get rid of those stigmas, I think is one, knowing what being ready for sex means for you, right? So, you know, even with the definition of abstinence, people are like, oh, no sex till marriage. I'm like, that's not what it means. It means you are choosing in that moment to not have any vaginal, anal, oral sex. If your reason is marriage, that's your reason. Maybe your reason is that you had a bad breakup, right? Whatever it is, you know, but I think people need to really define what being ready for sex means. That means you're comfortable with yourself, you're comfortable with your partner. Maybe you have your own beliefs about when you'd like to start having sex and all of these different things. But I think it also means that should I have a consequence, whatever it is, I have the tools and the resources to handle it. So if that's knowing where to get tested, or how much it costs if I don't have a free or low cost clinic in my area. If I have an unplanned pregnancy, what are my options? Where do I live? What are my state cutoffs? Should I choose to terminate a pregnancy, or should I want to adopt? What do policies look like that? And I think there are things that people don't think about because they have this very traditional idea of sex. And we have to get rid of that, and I just really want people to just realize that sex is incredibly normal, and to stop judging other people's behavior based on what you do, or maybe what you wish you did also is what I see a lot of. Everyone is completely different, and I just think if people have an educated approach on what to do before, during, and after your encounters, it would be much better. But those are just some of the messages, I like to give to my students, is really knowing who you are. I think is a really big part of sex that people often forget. It's totally, pleasure and who this person is, or, of course there's other, different parts of sex and things like that. But, I think part of it is really knowing about who you are as well. And then you might start to understand other folks as well if you understand yourself. Did that make sense?
100%. I'm in awe.
I started rambling a little bit.
I'm like,
no, you're so smart. Please just keep talking.
I know, I could talk forever. It's just because everything you said was so spot on. And I think especially for our audience of college students, like that, making the decision to engage in any type of sexual activity at any, like, the range of behaviors, it is such a personal choice in every single moment, whether it's with the same person or with multiple different people, I love that message of know who you are, know what you want, know what you like, know what you don't like, have those conversations, that's why we talk about consent and everything. It's not just it's not a contract, not just a contract. It's not a contract at all. It's a conversation. It's, a part of the experience, very integral, necessary part, but it is a part of it that makes you think about what do I enjoy? What do I not enjoy? How can I be safe? And this whole conversation is such a huge part of that. So thank you so much. I'm just so glad thank you for being here. Thank you for doing the work you do. It's amazing.
It really is. It really is. And I think we've gotten feedback on Real Talk about how we kind of, Real Talk makes these really big, sometimes seemingly unapproachable topics feel less intimidating. And that's exactly what I think you helped us kind of do in this episode, because I have 1,000 more thoughts and questions. And I, having this conversation with you, I don't feel nervous about the fact that I have those questions. It just feels normal, and it's a thing, and we can have those conversations. And sure, this is an episode, but now it's a conversation that we can have with our friends and in our communities, and hopefully people who are going to watch this will feel that way too.
Yeah, and it's so true. Cara, you mentioned consent, and I feel not 100%, but maybe a solid 90 or a high B percentage of consent problems would be gone if we just talked about it. Right. If we just talked about it. And that's with any topic, right? Some folks just don't know. They view something as that's the only way. So what do you mean? Right. And all those other perspectives. But I see consent, or even, you think about racial disparities and all kinds of things. It's lack of knowledge or exposure. And so, this platform is awesome because, if you've never been exposed to it, we can't necessarily expect folks to learn. So this is good.
I would love a part 2 if you're open to it. Sorry, I'm putting you on the spot because we're recording, but.
That's awesome.
Because I too, Sydney mentioned she has a bunch more questions. I know that I have more, and there were so many other things that we didn't get a chance to talk about. So yeah, I think this has been amazing. So thank you.
Absolutely.
I think I have 2 thoughts right now that I want to make sure I just kind of put on the table, and I know obviously what time it is, and my first thought really briefly is a little while ago, you were talking about all the different types of medication that are out there for different STIs. how do I want to frame this? So thinking of medication, thinking of doctor's visit, testing, all this stuff, I think finances, money, insurance, all that stuff that people might not have access to. For victims of domestic violence or sexual assault in the state of Connecticut and a lot of states, there's financial resources to help with that. So if you get an STI as a result of an assault, the Women's Center can help you access those resources. I just kind of want to throw that out there as like, this is the thing.
Oh, yeah. That's awesome.
And I'm sure it exists in other states too, but like we know how to navigate that system here in Connecticut.
Totally.
My other thought too is because we work with people and we talk about dating violence all the time and different aspects of like emotional abuse and gaslighting and things like that. This just can open a door to a lot of manipulation. I think if somebody's in an unhealthy relationship in terms of like making somebody feel belittled or talked down to, or just gaslighting them that like, this isn't me, I didn't bring this into our relationship, whatever that sounds like. And I think I just want to say, like, if you feel uncertain or uncomfortable, or you feel like you don't know something that maybe your partner is making you feel uncomfortable, safe around this topic, like the Women's Center can connect you to how to help you feel safe in that space. And I just knew I would be sad on anything to that, or Jasmine, you too, but that was just my thought after everything that you kind of brought up.
Yeah, so important. And I Florida has very similar programs, not necessarily through, we have women's centers that are different, but absolutely. There are also a lot of federal dollars. So even if you are just someone who has an STI or however that STI resulted, there's a lot of federal dollars within different agencies that can help, make that treatment or that testing free or low cost. A lot of them are on sliding scale programs as well. So it's, based on how much money you make. So it can be very, very low cost. I think the biggest challenge that folks have is finding those places, because instinctually people will go to their doctor or to a walk-in or the ER. And unfortunately, those places, there are going to be no programs. They're going to charge you, per test, per treatment. And that can add up very quickly.
Right.
I know in our area, we looked it up, like how much a full STI panel would be if you walked into the emergency room. It was like $20,000. We were like, what? These are free.
Not expecting that.
Right. We were like, hold on, how much?
Who could afford that? That's like a car. Like what?
Right. And so we were like, no, please don't go there. And obviously that's without insurance, but still, I don't want my deductible to be because of my STI testing.
Wow.
Right.
So, I think that find a health educator, find someone in your area who can kind of direct you. It's always advice I give.
That's awesome. That's cool. I think there's just so many resources out there. I'm so always so happy to learn about them. This was just an awesome conversation. And it was like we kind of said in the beginning, one of our longer ones, but we knew going into that was going to happen. Cara, did you have any last thoughts that you kind of wanted to?
No, I think my only response would be I am inspired to find all of the resources and we will list as many as we can find in our caption. But also for any of the students, if we have a lot of nursing students and things, they may be very much aware of other resources in the area. So for our audience, if you have any other thoughts or suggestions or anything like that, please send them our way, but we'll put them in the caption.
Awesome. Cool. Well, thank you so much for being here.
Oh my gosh, of course. Thanks for having me. This is fun.
Yeah.
Yay. I know, we love it.
Part 2.
Yes. Can't wait. And then for everyone listening, if you have any thoughts, comments, suggestions, resources that you know of, please feel free to reach out to us. Remember that these videos are all pre-recorded and released on Instagram and Facebook every Tuesday at 5 p.m. And we will see you next week.
Thanks, everyone. Thanks, Jasmine.
Bye.